Hello everyone, hope you all are doing well. So let us learn about the ultrasound. Here I'll be discussing about its basic principles, generation of ultrasound and application of ultrasound. Methods to generate and detect ultrasound was first became available in the United States in 19th century. First large-scale application of ultrasound was for sonar during World War II. Ultrasound is sent from the submarine through the water, then the detector used to pick up the echo of the signal. So like that they used to use the ultrasound to calculate the distance to the objects under the water. Then it has been used for clinical purpose for the past 50 years or longer. Ultra means higher, which has higher sound waves. Ultrasound has high frequency, which is more than the upper limit of human audibility frequency. Human can hear sound with a frequency of 16 to 20 kilohertz. So, ultrasound has more than 20 kilohertz of frequency. Sound is a form of a mechanical acoustic energy which propagates through vibration in various medium like air, water, etc. Therapeutic ultrasound. Therapeutic ultrasound is the ultrasound which is used for the treatment purpose. Frequency of therapeutic ultrasound is 0.7 to 3.3 megahertz. Then coming to the types of ultrasound. Ultrasound has three forms like conventional ultrasound, low intensity pulsed ultrasound, non-contact low frequency ultrasound. Coming to the first type of ultrasound, that is non-conventional ultrasound, which is the oldest and most conventional therapeutic type of ultrasound. This first picture is conventional ultrasound. It will be delivered at low or high frequency. Intensity is using pulsed or continuous delivery mode. Application with a contact or non-contact. We will use aquasonic gel or tap water as a coupling agents. It is mainly used for thermomechanical effects on ligaments, muscle, tendon disorders. So coming to the second type of ultrasound, that is low intensity pulsed ultrasound, which will be delivered at medium frequency and less or lower intensity than the first type, that is conventional ultrasound. Here we use stationary application which is in contact with the skin, and we use ultrasonic gel as a coupling agent. This kind of ultrasound is used mainly on fractures, bone fractures. Then coming to the third type of the ultrasound, that is non-contact low frequency ultrasound, where we use lower frequency with the intensity lower range. We use sterile saline water which is contained in the bottle as a coupling media. It is mainly used to promote the dermal wound healing. So coming to the basic principles of ultrasound. It has a similar properties of sound. It has high frequency mechanical waves. So you should know about attenuation, is also called like absorption. When the ultrasound travels through material, it gradually decreases in intensity as a result of attenuation. It attenuates more quickly in denser substances. Air has less density, so we use coupling medium to enhance the absorption in the skin. So ultrasound waves travels longitudinally by alternative compressions and refractions of the molecules in the medium. Compression is the area which is more denser. Refraction is the less denser area. The wave which is passed can be reflected, refracted or absorbed. If the waves gets absorbed, then this kinetic energy will convert into thermal energy. The denser tissue will give a refraction or bented waves. Angle of reflection is always dependent upon the angle on incidence at the tissue. So, ultrasound has two physical properties, that is thermal effect and non-thermal effects. Thermal effect is the increase in tissue temperature. Non-thermal effects are cavitation, acoustic streaming and micro cavitation. So cavitation has two types, stable cavitation and non-stable cavitation. Stable cavitation will have a non-thermal effects. Unstable cavitation, at the end it will burst or explode and produces more temperature and increases pressure. So that is the reason it will be having thermal effect. Then coming to the acoustic streaming, it is the steady circular flow of cellular fluid increased by ultrasound. Then what is microstreaming? Microstreaming is the microscale eddying or spinning near the any small vibrating object. Then coming to the production of ultrasound. Ultrasound has main two component, that is generator and applicator. Generator is a box which has electrical oscillator which will produce high frequency waves. Applicator has two key element, that is piezoelectric crystal and sound head, also called transducer. Piezoelectric crystal will be made up of zirconate or titanate which has a piezoelectric properties, that is expanding and compression. When the electric current changes its polarity, this expanding and contracting will occur alternatively. So that will result reverse piezoelectric effect. Because of that, a beam of acoustic waves will be produced which will pass through the sound head and reaches to the conducting gel and finally reaches to the treatment area. So this is piezoelectric crystal sound head. Here piezoelectric crystal is compressed. Here it is expanded. You should know about two things, that is effective radiating area and beam non-uniformity ratio. Effective radiating area is the area of crystal that moves, is the effective radiating area. The crystal is not uniform nor it expands and contracts uniformly across the area. So this will lead non-uniformity of the acoustic energy. So that is called beam non-uniformity. Then coming to the clinical applications, you can apply ultrasound on soft tissue shortening, pain control, dermal ulcers, surgical skin incisions, tendon and ligament injuries, resorption of calcium deposits, bone fractures, carpal tunnel syndrome and phonophorosis. Contraindications and precautions. Contraindications are malignant tumor, pregnancy, central nervous system tissue, joint cement, plastic components, pacemaker, thrombophlebitis, eyes, reproductive organs. You should take a precautions on acute inflammation, epiphyseal plates, fractures, breast implants. Then coming to the application technique. Equipment which are required for applying ultrasound are ultrasound unit, gel, water or other transmission medium, antimicrobial agent and towel. So first stage is to evaluate. First you should evaluate patient's clinical finding. You should be able to identify the patient's problem properly, patient's condition appropriately, and then set the goal for the treatment. You should select the goal, whether you want thermal effect of the ultrasound or you want non-thermal effect of the ultrasound. Again, that is based on the condition of the patient. Then second stage. Second, you have to determine whether ultrasound is the most appropriate intervention for the condition, whether it will produce beneficial effect on the condition or not. You should know the effect of the ultrasound on particular whatever the conditions patient will come up. Then coming to the contraindications, then the next stage is you should always know whether the patient is contraindicated for ultrasound, like whether he has diabetes or any blood disorders. This you will come to know by taking proper history. Then you have to take a precautions if there is any acute inflammation or fractures, etc. Then applying ultrasound medium. So apply enough medium to remove any air between the sound head and the treatment area. Selection of appropriate ultrasound medium is very important. It shouldn't be staining. It shouldn't be allergic for the patient. It should not rapidly absorb by the skin, and it should be inexpensive. So there are three forms of ultrasound medium are available, namely gel, water immersion, gel pads. Gel pads are used whenever we are giving ultrasound on the bony area. In case if you are planning to apply ultrasound under the water, place the area in the container of the water. Then you give the ultrasound. Keep the ultrasound sound head 1 centimeter away and give the treatment. Then ultrasound head movement. First of all, selecting the ultrasound head is very important. You should always select the ultrasound head which is half the size of the treatment area. Then coming to the orientation. Keep the sound head perpendicular to the treatment area in order to get the better absorption of the waves. Now how to move? What is the pattern to move? So you have to move the ultrasound head or sound head of 4 centimeter per second speed. You have to give slow stroking. Stroking can be done in two ways, overlapping circles. This overlapping circles can be done in clockwise direction or anti-clockwise direction. But overlapping previous circle by approximately half the ERA is very important. Then second type is parallel stroking. Parallel stroking can be done in horizontally or vertically. Again, overlapping the previous stroke is very important. Then coming to the treatment parameters. So you have to select the frequency according to your depth of the tissue. If the depth of the tissue is 5 cm deep, then you have to select 1 MHz. If the depth of the tissue you want to treat is 1 to 2 cm deep, then you have to select 3 MHz. Then coming to the duty cycle. Duty cycle is dependent upon your treatment goal, whether you want thermal effect from the ultrasound or non-thermal effect on the ultrasound. Again, goal is depending upon the patient's condition. So, to increase the tissue temperature, that is to have the thermal effect, you have to keep 100% duty cycle. For non-thermal effects, you have to keep pulsed ultrasound with 20% or lower duty cycle. Then coming to the intensity. Again, intensity is also depending upon your treatment goal. If you want thermal effect, then for 1 megahertz frequency, you keep 1.5 to 2 watt per centimeter square. Then for 3 megahertz, you keep 0.5 watt per centimeter square. For non-thermal effect, you keep 0.5 to 1 watt per centimeter square. Whenever you are giving the ultrasound to have the thermal effect, patient should feel the heat after 2 to 3 minutes of application. If the patient is not getting the heat, that means the parameters which you have selected is wrong, and there should not be any other uh, complications like burning, all those things, burning and all should not be there. Then coming to the duration, again the duration is uh, uh, based on the treatment goal, the size of the area to be treated, and the ERA of the sound head. So 5 to 10 minutes for each treatment is found to be effective. Area to be treated. So area to be treated is depends upon the ERA and the duration of the treatment. So always the treatment area should be equal to twice the ERA of the sound aid and can be treated in 5 to 10 minutes. Number and the frequency of treatment. Effect should be detectable within 1 to 3 treatments. If the patient is not getting any improvement, then you have to change the parameters. Then winding up. Switch off the knobs and clean up the area of the treatment and then the sound aid. Finally, you will have to document. You have to document about area of the body you have treated, frequency, intensity, duty cycle, treatment duration, and whether the ultrasound was delivered underwater, like what method you have used, how you have delivered the ultrasound has to be documented, and patient's response to the intervention should be noted. So now we will discuss. So now we will see for few conditions how we can give ultrasound. For example, myofascial pain syndrome. It is also called trigger points. Patient will be having pain on the trigger points. So it is found to be effective when combined with a stretching. So for that, first you should know the condition properly and you set the goal. What is your goal? Because the patient have a pain, your goal should be in reducing the pain. So you inspect for any trauma is there or any acute inflammation is there and check for the contraindication. Okay, then select the appropriate medium, then select the appropriate sound head, and instruct the patient what you're going to do. Clean the area, then set the parameters. You keep the parameters for the frequency of 1 megahertz continuous ultrasound of 1 to 1.5 watt per centimeter square over the trigger point. You should only give double the size of the sound head. You should not give more than that. If the sound head is 5 centimeter in diameter, then you should give 10 centimeter diameter as a treatment area. Then coming to the bone fracture. Whenever you are giving ultrasound for the bone fracture, you should be very cautious because if you give high dose of ultrasound, it will increase the pain. But if you give low dose of the ultrasound, studies have shown it will reduce the fracture healing time. For that, you should select the ultrasound parameters which is of low frequencies. that is 1.5 megahertz frequency. Okay, then for carpal tunnel syndrome, carpal tunnel syndrome for carpal tunnel syndrome also, ultrasound is effective in reducing the pain. Basically here we are giving to reduce the pain. So select the parameters for reducing the pain and follow the procedure. Follow the steps like ruling out the contraindications and taking precautions, selecting the ultrasound medium, selecting the appropriate sound head. Everything should be followed stepwise.